So, hi Hugo, welcome back to Non Traditional Headspace. It's good to see you again. This is going to be our second part of the first episode that we had before. And I'm really excited about this because we're going to be continuing our conversation. And I'm sure that it's going to be interesting because we're going to be as well touching a little bit more fun at the end of this episode topics. So tell me, how's everything since the last time we spoke? And then we're going to start right off with the first part of this episode, which is talking about a little bit, and just to put people back in context of what our last conversation was before I go on. We ended up with you sharing a bit of how was your entire experience with weight loss and how this impacted your life in general. And then we talked a little bit about relationships as well, and your tips about how to use part of the media accounts that are available now out there to use as online dating. And in order to continue the conversation then, based on that we have shared with the public who's listening already, tell me about now, what's up with you currently, like I said. And when I say this, it means talking about as well future plans that I know you have when it comes to your career. And what does that imply? Like, what are you going to make happen? We're starting a new year, of course. Now it's 2024, the beginning of 2024. And what does that represent for you at this moment? So go ahead.
First of all, thank you for having me once again. I am truly happy to be here. I love our last conversation. I think that even though it was a little bit long,
Yeah.
we cover a lot of topics that were really interesting and were received. And I'm thrilled to be here. Since last time, it has helped me a lot to put my life in perspective. There's a phrase that my therapist told me, that an activity, in fact, about finishing the cycle of the year. And I was always my train of thought was always like, why do people care a lot about New Year, New Me, and all the traditions that we do in Latin America about eating the grapes and running around, or going outside and running with a
Yeah.
suitcase, or I think hiding under the table, or something about money. I am more acquainted about the grapes one and the with the baggage, with the suitcase, but not with the other ones. But I know that people believe in that, even underwear color and stuff like that. And
I do.
I don't judge.
I do.
You do. That's okay, but I don't judge with that at all. But for me, for example, in my weight loss journey, I always heard people say that no, January 1st, I'll go to the gym and
Yeah.
I'll do all my lists, and New Year, new me. And for me, it was like, why do people wait? Yeah, you can indulge yourself Christmas Eve, uh, 31st, December 31st, New Year's, whatever. But you can start doing changes before that. And
Yeah.
that was always my thought. But since personal things that happen and professional as well, but especially personal, we did a conversation about that, and she told me, yeah, it's New Year. What are your thoughts? What are you leaving behind 2024, 2023? What are you looking for in 2024? And for the first time in my life, when the clock, it was 12 a.m., I truly believe that it was a new opportunity, a new chapter. I don't know. It was. I always say that, and I said it the last podcast, that I always trust my gut, and my gut feeling told me like, yeah, it is a new year. It is a new perspective from you, for me, and I have learned a lot of things since the last time we spoke, that has truly helped me as a person, that I know has helped my medical practice, not only my patients. It has helped my friends, because sometimes they ask me for advice, and I try to share with them what I've learned. Even though I am currently, like every single person in this world, going through stuff, and but what I've learned, to share it, because information has to be shared. And professionally, um, I like what I do, and I think that for a person, there's this psychiatrist. I don't know if you've heard about her. She's absolutely brilliant. Probably one of the persons in one of the individuals in this world that has the most profound emotional intelligence that I've ever heard or have seen. Her name is Mayran Rojas Tape. She's a Spanish. She's from Spain. She's a psychiatrist, absolutely brilliant. She has two books. The first one is Cómo hacer que te pasen cosas buenas, how for good things to happen to you. And the second one is Finding Your Vitamin Person. Encuentra tu buena vitamina. It's very popular, very insightful, very scientific. That's what the most part that I love about her, because she can bring for the most simple language and the most complex language for medical people that are around medical fields, and she uses it together, and it's quite amazing. If you haven't heard from her, please do. Her grandfather was a psychiatrist, her father is a psychiatrist, her sister is a psychologist, her aunt is a psychiatrist, his cousin is a psychiatrist. So yeah, it's very well known, very grounded, very insightful information. And she says that for a person, and her father as well, very insightful psychiatrist, Enrique Rojas, he says that for a person to be truly happy, they have to have a balance between what they want, what are their dreams, and what they have achieved in between your professional and in your personal life. If you have a balance in between both things, you'll be happy, because happiness or happy things, it's not something, it's not an object, it's not a circumstance. You can be thrilled, you can be excited, you can be emotional, or whatever adjective you want to use, but happiness is how you interpret it, how you will interpret what happens to you. It's an interpretation for you to happen, because good things can happen to you and you would only see the negative ones. You will only focus on the negative ones. Yeah. So it's more a perception. There's sometimes that you will have, and for as well, for that to happen, to interpret, to enjoy when good things happen to you, and how to deal when things that are not so good happen to you. Because life is like a wave. It comes and goes. It's not linear.
Definitely. Yeah,
And
I
for a
agree.
long time, yeah, yeah, absolutely. And for a long time, I've had even though I work in different places, I work in every single part of the medical fields, from emergencies and helping with surgeries and adults, children, um, um, basic medical consultations, hospitalization, etc. I've known that I know that I have always had the will for me to continue studying, and I have studied, even though right now I'm general practitioner. I haven't started my specialty. I work a lot, and I have the opportunity to go to Brazil and start my specialty. I like I like the clinical part of medicine. I like when a patient tell me some symptoms, and I try to help them, because the problem with any patient, with any patient, any disease, are not the symptoms. The symptoms can be mild, they can be severe, and you can help to control them. But the problem is not that. The problem is what causes them, and it's like a puzzle. It's like
Yeah.
it's like a puzzle. It's like for you to make a mental slate and subdivide every single possibility for a patient. And that's the part that I always love in medicine. And I've always loved internal medicine. And in the current years, I've learned to know that I like gastroenterology. And the place that I am applying, there's a big chance for me to start there in a very short time. So I need to prepare myself to move from Honduras to Brazil, and which I'm absolutely excited about that. Not scared at all. Actually, I'm truly excited because that's the part of my life that I think that I need to work more, even though I work a lot. Because people
Yeah.
think that, oh, you're not a specialist, you have no medical specialty, you are a failure at all. I am good
No,
at what
no,
I do.
no. Yeah.
I am good at what I do. I am a good physician. I am a good doctor, and I am truly proud of myself, truly. And even though if there was an opportunity for me to to go to Brazil and make my medical specialty, there's a lot of options for me to study. But there's this opportunity. I've been working on this for about almost 2 years, and last December I went to Costa Rica on October of last year, and
Okay.
I have to approve with a very high note my Portuguese exam that is called a Selpibras.
I was going
They,
to ask you if you knew the language already. So you
I
do
do.
know
Yeah,
Portuguese
yeah,
now.
I do. I do. Yeah, yeah. I'm certified actually. Yeah, now I'm truly
Wow.
happy. I am truly proud of myself because of that.
And which are the
And
levels for the language for you? Because here, for example, it's they classify it in B1, B2,
yeah,
C1,
yeah, yeah,
C2. I don't know if it's the same for you.
yeah, the
Yeah,
same
it's the
in
same. Okay.
Spanish and in English and in French is TOEFL, right? No, in French is DELF. I'm sorry, in DELF.
Delph,
DELF
yeah.
in French. Yeah, yeah, TOEFL for United States. And in Portuguese, for Brazil, Portuguese, it's
Mhm.
Solpibras. And
Okay.
I approve. I passed my exam, and that was the
Nice.
hardest part. That
Yeah.
was the hardest part, and I am truly excited. And like we talked before on the podcast, I know it is a big change because when you make a decision, then is any decision, um, start or quit a relationship, or start or quit a job, or any decision, move to another place. There's the conceptualization, the idea that you're doing that, but there's a phrase in Spanish that you know very well that is cuando estás montado en el toro. When you are in the situation, it's completely different of what you thought, because not I know that not everything is going to be rose color and
No.
completely wonderful. And I know there's a cultural difference, even though Brazilian people have a reputation, they're truly happy, very like
Yeah.
Latino, like us, right? But it's a different culture, and it's a different language, and it's a different country. I'm not going to have the amenities that I do here, or with the people that I truly love that are around me. I know it's going to be hard, but even though I know it's going to be hard, I know I'm going to be okay, and I am happy with that.
Nice.
I I I've always I heard a phrase last year, finishing last year, and they said that true confidence, true confidence
Mm-hmm.
is doing something and knowing that even though you may miss, you may not succeed, at the end you'll be fine. And that's how I feel right
Yes.
now. That kind of confidence.
Actually, it is true. If you have confidence and you're not afraid of failing, then the outcome might actually surprise you in the end because you're already preparing yourself mentally that no matter what happens, you're going to be okay. Not that you're going to fail, actually, but if it would happen, you have already worked that part of yourself to be prepared to face that. I like that phrase.
Yeah,
I like it.
yeah. It helps me a lot when I'm. Everyone has problems and tribulation and doubt. That's normal. That's human, right? There's not a, oh, I'm amazing, or he's so lucky, or she's so lucky, or that's so exciting. No, everyone has fears, everyone has doubts,
Yeah.
everyone can second guess stuff because that's an uncertainty and people want to be certain.
Yes.
When you get something new, you are like, what am I going to do? Or what if it fails? Because um, I know it's not part of this podcast, but there's something I've learned from Marian, the psychiatrist that I told you, that
Mm-hmm.
it's the importance, the scientific importance of your inner voice. Your inner voice, it's so important. She says that the inner voice that you have, it is made when you are little. 50% is made before you are 6 years old. Then 25% is between 6 years old and 12 years old. And the next 5% is made after you're 12. And it's a combination about mostly your caregivers, but then your teachers and people that are really close to you that made an impact on you. And it's a reflection of how your caregivers, your parents, or whoever raised you, uh, talk to you.
Mm-hmm.
Uh, Another thing is when if there are a couple or a dynamic in the family, how they talk to each other, and the other part is how they talk to other people about you. It's like if they tell you you're so dumb or you're so clumsy, that's direct for you. Or you see your parents yelling at each other or having a toxic situation, and then when they talk about you and you're in front of them with somebody else, they say, no, but my daughter, my son is so smart, or my son so responsible, or my daughter or my son, they're so dumb and they are so spoiled. And that kind of voice, that kind of speech that you hear, because when you are little, you are blank, you're a blank canvas. You are like a recorder machine. I know most people that do not know that there's a recorder that you have a little cassette and you can record words that only digital, that's the physical one. But we
Yeah.
are like that, and that forms our inner voice. And if the inner voice that it's formed with that, that will go on the rest of your life. Every
Mm.
time everyone has an inner voice, and if you always say, no, you're so dumb, or you're so dumb, you're never gonna make it, or where you're not like your sister or your brother, that will repeat on you and repeat and repeat and repeat. And every time there's a struggle, you will repeat and repeat and repeat, and that would affect your life. That's
True.
our job for us to change that. And I have changed my inner voice a lot,
Mm.
and that has brought me a lot of confidence in this moment,
So
and
that's
that brings
great.
happiness.
That's
Yeah.
why you have been able to achieve and get to where you are, I think. You talked about growing a lot through all this experience, even recently that we last spoke. You say that you have grown still. And I think this is something that is also very important to recognize, that you're still learning things throughout your journey in life, that it's a constant reminder that you're going to keep learning about yourself. And that's good. A lot of people, I think, they get stuck and they, for some reason, think that that's the end of who they are. They believe this, like I think you're talking about traumas, if I'm not wrong. Like these are childhood traumas. Like people, when you describe it, you put it in a very nice way. But for me, it's quite simple. For me, it's traumas. And a lot of us are afraid of listening to that. Like you have childhood traumas that you have to deal with and overcome. And like you said, you replace your old inner voice with a new one. And people are not willing to accept these things most of the time. We have, and I include myself there too, because I think it's difficult to identify those traumas or where did they come from, because I still have not, honestly, in my case, I have still not identified exactly where, like the things that trigger those fears that I have, where do they come from? Because probably I still think that everything that happened in my childhood was normal, but maybe it wasn't 100%. And those are the things that if you, like you have been able to identify and replace them with, the good thoughts that you should have about yourself, that's when you have already achieved a lot. So you have grown, and that's excellent. Yeah.
Thank you. If I can add something, you're not the same person, and this is for you. This you're not the same person that you were when you left Honduras, or the person that you left when you left Guatemala, or
Mm.
Panama, or now that you're in France. You're not the same person that when you were a teenager, or in your first or your actual relationship. And every step and every decision and every experience that you have taught you some things about yourself. There are things that you will learn by yourself if you truly want to do the work, because the problem is that no one likes, yes, this is in general, no one likes for someone or their inner voice, if it's a negative one, to tell them there's something wrong about you.
Yeah.
And it's scary because it's an unknown place. It's like you saw this movie, uh, I think it's Inside Out. It's a Disney movie. There's this
No.
part when there's
It's
this part in the
Disney.
movie.
I only have like the memories of the really old ones when I was little.
No, I don't want to spoil the movie for you because I think it's a really nice, because I think Pixar makes movies that are suitable for kids and for adults because of the
Oh, it's a
message.
picture. Okay.
It's a picture, yeah. I'm sorry, Disney picture movie. Yeah, so
Yeah,
Inside
yeah,
Out,
they're
it's
now
about,
Disney. Mhm.
yeah, it's about emotions, right? And there's a new one coming, and the old one, there's a part in the memory that it's all black, and there's an old memory, an old character that I won't spoil because I want for you to experience the movie.
Okay.
And that part, it seems dark, and it's kept down in our brain, and most of the people don't want to go there because obviously no one wants to talk about their difficult situations, because you said something that it's truly interesting. There's a psychologist in the place that I work, and
Yeah.
since I've gone to therapy, I see a whole lot of spectrum. When and this is for you, because I will share it after the podcast, the books for you to read, because I truly encourage you for you to read. It will change your life. There's a lot of things that just happen voluntarily. Most of our communication, Denise, it's nonverbal. You can
Yeah.
see somebody and you can see if they're happy or they're mad or they're sad, because they can be really subtle or they can be really loud. And you can just see them, or every person can have that perception, right? That's
Yeah.
nonverbal. And I always, there's, our mind doesn't difference the doesn't make cannot make a difference between a real threat and an imaginary one. Most of the things that worry us, they won't become true. There's
Yeah.
statistically, Marian says that it's 90%, but and study said that it's 91.4% of the things that worry us will never happen. But our brain doesn't cannot make a difference between both of them. I'll make an example for you.
Okay.
Let's say
Okay.
that we are in Honduras or any other country or any other place, and it's 2 a.m. We come from a party, and we're going to the place we're staying, whatever, with some other friends. And we're going down the street, and then we see three guys coming next to us, really shady ones. And since we're Latin American, we know we need to be like
Yeah.
extra careful, right? Yeah, there's
We
that
start
thing that
running.
we have eyes on our backs. Yeah, there's a phrase that we say. Yeah, so they start yelling at us and they're telling, "Give me your phone, or I'll shoot you," or whatever. Our brain, there's a response that is an automatic response. You don't say, "Okay, brain, like some warning's coming, act." No, our
Yeah.
body automatically, our nervous system, that's the autonomous one, activates a part of it that is called the sympathetic one, that it's about the run. You either run or you fight. So
Yeah.
we fight the guys or we run. And the changes that it makes in our body, it liberates different hormones, and one of them is named cortisol. That's the
Ah,
stress hormone. Okay,
yes.
so
I read a lot about the
uh,
cortisol.
well, and you will learn more about with Marian's book. You will absolutely
Okay.
love the woman. And when that happens, as you have read, it helps us in specific moments for changes in your body, for different blood flows to go to our extremities, our arms, our legs, for fight or run. More blood to our heart, more blood to our lungs, so we can pump more blood our heart and catch more air for us to run or fight. And different parts of our body, our gut, our liver, our kidneys, etc. They get just enough, right? And after the threat, even though it takes 6 to 8 hours for it to lowers, you will still have the sensation, and that's the real one. The imaginary
Mm,
one is like if I told you, for anyone that is listening, and even for you, let's say that your sister, your mother, and your father are going to a trip. They're saying they're in France with you, and they say, I don't want to be here anymore. I want to go to Germany. And it is raining or it is snowing. It's 1 a.m. And your
mhm,
father hasn't slept a lot. He has jet lag, whatever. And then he says, Denise, I will go get the car. But Dad, what are you doing? It's super dangerous. You're gonna do it. It's snowing, it's raining, whatever. You don't know the streets. It's really dark. No, don't do it. No, I don't care. And he goes, and you cannot sleep. You're worried. You are stressed, and your body feels it, and your physical and your mental state changes
mm.
because you don't know what will happen. But then your mom or your dad call you. We are right to Germany, whatever. One is a real one. One is an imaginary one. That's something that may or may not happen. Your
Yes.
body doesn't know the difference. Your brain doesn't know the difference and activates that stress. So when you are stressed and stressed and stressed and stressed and stressed, that cortisol level is always up, and you cannot relax. The cortisol is for us to be more attentive, more focused
Yes.
in punctual points. But when we are continuous stress and stress and stress, we cannot relax. And in that case, it has repercussions in the person. There is
Mm,
called somatization symptoms. You can have headaches, you can have insomnia, you can have lower back pain, you can lose or gain more willing for you to eat. You want to eat more, but usually you eat less because, like I told you, in cortisol levels, the first part, because our second brain is our gut, is our gastrointestinal system. It's a separate brain from the one that everyone knows. And you can feel bloated because if it affects your microbiome, your microbiota actually, and you can have tingling sensation in your extremities, and you can have
yeah.
intrusive thoughts and thinking and thinking and thinking and thinking, or you can have different mood changes, or you are quickly to get mad. There's a phrase that well known in Spanish that is called mecha corta.
Yes.
In English, it's like people that quickly react. They
Yes.
get mad super fast, and that's not a normal state. That's a person that is in continuous stress levels. Cortisol up levels can get for you to have a propensity to have diabetes or high blood pressure, hypertension, or have a propensity for you to gain weight, for you to have autoimmune disease, so your body attacks its own body, like
Mm-hmm.
I don't know, lupus or rheumatoid arthritis, whatever.
Okay.
Or you can have cancer, and all those effects, because a person, it's like a four-legged chair. It's body, mind, emotions, and soul, spirituality, whatever people
Yes.
believe. If you have the four legs here, it's stable, it's fine. But
Yeah.
even though you have three that are not okay, and you have one that it's moving, that it's not stable, you will fall. So you need to work on that. And for me, and I explain to you in detail, because that's the things that I tell my patients. And I tell them that because sometimes they just tell me the symptoms and the symptoms and the symptoms, and usually you just give them, yeah, like take something for for your muscle stiffness, or take something because of your headache, or take something because your chest pain, you have chest pain that's not for like a cardiac problem properly. It's more like a muscular cartilage bone problem.
Yeah.
And people think that that's normal, but when you don't know what causes that, if you don't go to the root, the root problem, because you can have other things that can add up and add up and add up, other diseases, but if your mind is not right, it will affect everything else. And it is important for us, even though that, going back to trauma, even though that it is scary for us to go through the trauma and understand that those things or those situations, or even some people, can cause elevation of cortisol in us. It is
Yeah.
important for us to understand that, because we need to be like a fine liquor, like a fine wine. And aging, even though it is scary for a lot
Yeah,
of people, because yes, it is.
it is.
And we need to respect that, because people always say that, no, that you're being dramatic, or you look fine, you don't look your age. It doesn't matter, because
Mm.
it is a true scare for you. And you need to respect that in that person, because it is true for them, and you need to be empathetic with that. But they also need to understand where that fear comes from. That's for that not to cause a middle life crisis, or a 10-year crisis, or 5-year crisis, that it's quite common. So you need to understand the root, that what is causing you that, because you've always seen life with the eyes of the people that raised you, and you say something about normality. It can be normal in your house that no one ever talk about feelings, never
Mm.
hug you, never gave you a kind word, or barely gave you a kind word, and you learn to be hyper independent, because you knew that you cannot trust your caregivers. Or it's normal for you that have a house that they hug you and they tell you they love you, or another household that what you heard was only screaming and screaming and screaming. That's normal for you.
Yeah.
Normality, like we talked the last podcast, that's volatile. That's not a steady line. And you need to understand that there are things that, even though you are accustomed to, you can
Yeah.
change that. And if people want to learn about themselves, even though this is scary, and especially in Latin America, that when they say, no, you need to go to a psychologist, or need to go to a psychiatrist, they automatically think, oh, you're crazy. You have a
Mm.
problem. You can tell them they
Yeah.
have cancer, they will be sad. Or you can tell them that they have a fatty liver, or they have asthma, or they have diabetes, or they have high blood pressure, or whatever, and they will talk freely about that. Maybe cancer, not because there's a stigma as well, but people, even though, will talk, yeah, I got cancer, or got a tumor, or whatever, and people will talk about that. But
Yeah.
people will not talk about, I'm feeling sad, I'm feeling stressed, I don't know what I want. The two main diseases in our century, and is for our
Mhm.
generation, and the people that are older than us, or especially the younger ones, it's not diabetes or high blood pressure or cancer, is depression, anxiety. Those are the
Mm.
main ones. Those are the most important ones right now. Every single person
Depre
you talk,
Depression and anxiety. Okay.
yeah, yeah.
Interesting.
And
I
we
believe it.
we
Hmm. I do.
everyone is anxious. Everyone is anxious, even though they don't want to verbalize it, because the people they're more like, for them to internalize things, they are.
Yeah.
And I think that it is important for us to try to understand where does our trauma come from. It is important for us to try to understand that, even though we see life in a way, and we think, oh, that's it. Oh, like French people say, c'est la vie. It's
We.
not like that. No, it's not like that. You can change. Even though you don't see things right now
Mm.
that way, you can change. But it takes time. And like we talked about last time, it takes patience.
Yeah.
It takes patience, not passionate patience.
Yeah. So I think right now we already stepped into the next segment of this episode. But before we keep this discussion and conversation, which I find absolutely interesting, just to close up the first one, you're going to Brazil. I hope
Mhm.
everything goes well. Best
Thank you.
of wishes for you. And I hope next time we speak, we're going to be discussing what it's like to be in Brazil and how everything's going there. And of course, I would like to know the adaptation part once you're there, because it's
Of
interesting.
course.
Like you said, you're always going to, even though you're in Latin America, you're always going to see yourself in a different situation because it's a different country, it's a different culture, although they're not so far away either from Central America, where we're from. But definitely there's always changes, and we have to be ready to understand what's going on in a different culture. Now, we stepped into the next part of the episode, which is what we're speaking about right now. I would describe this as seeking for help and professional support, which is everything that you have laid out, or all that you have been talking about, and how can you identify things. And what you mentioned at the last part before I interrupted you here, how in our culture it is not well seen. And I actually want to tell you something, that it's not only in our culture, in Latin America. I've seen it here too. People are afraid, and I think this is in general. Maybe there might be certain cultures around the world, perhaps Africa. These people seem to be more open to talk about their feelings and everything among themselves.
Mhm.
Here in Europe, I've seen it too. People are not prepared to have those conversations because they fear some sort of judgment. They don't want to talk about why do they behave a certain way that is definitely attached, like you said and explained, from this doctor that you mentioned, to a certain percentage that is attached to your childhood. And also, with that being said, this is something that I want to ask you now, because you mentioned about, of course, cortisol levels, and you talked about somatic experiences that we
Somatization.
might have, somatization,
Mhm.
yes. And with that, because I have read about this and I have done certain things to try to level my cortisol levels, I've done somatic exercises. Have you ever heard of those somatic exercises? This
No,
is
please tell me.
uh, this is a more holistic approach
Mhm.
to how to balance your cortisol levels. And there's these exercises that have to do with breathing and very
Mhm.
slow movements that you can do that apparently trigger certain parts of the body that we normally wouldn't use while we're doing regular exercise like running or jogging or walking or
Mhm.
even weightlifting. These are more connected to your nervous system because you're breathing at the same time. It's not exactly yoga either, because it's not yoga. Yoga, even some people don't believe it, it demands a certain level of physical uh, demand to your body. You end up sweating if you're in an intensive yoga session. With these somatic exercises, they're quite soft and they make you reflect a lot about what's going inside in the breathing and everything. And some of the exercises can even cause certain shaking in your body. So I've done it. It's scary. I had no expectation when I was doing it. I thought this is crazy. Surely this is people make it up. They start shaking because they start going through things in their minds. I don't know. But actually it happens. I was scared when that was happening. And the reactions that they say you can have, it's either you start getting like worried that something is happening to your body in that moment, or you start laughing. I started laughing because I couldn't believe that was happening. Like, I thought this is insane. This is not real, but it is real. So I experienced it and it was real for me. But I didn't know if you had ever heard of those exercises. I tried them because also my coach, she was the one who recommended me to do it. I gave it a try. I liked them a lot. And every now and then I go back to doing some of them because I feel like I need to relax in certain moments of my life. So I do it. Have you
And
ever
they
heard
have
of
helped you. Uh, okay. I love when we talk about this. There's a lot of things that we can talk about actually, but I don't want
Yeah.
for our podcast to be 3 hours long.
Yeah, yeah, yeah.
Um, for regulating, no, I practice a lot of things. I practiced yoga for a very long time. Um, I really like yoga and also Pilates. It's completely different. I always try to do things that I've never done before, getting outside my comfort zone. I actually like doing that because I think that I'm pushing myself, doing things that I don't like you don't know if you will like something unless you do it. If people say, I
Yes.
don't know, do it. If it doesn't affect your core beliefs or your integrity, give it a shot. Why not? Do something different. Life is an experience, right? And I've done different things for me to regulate my cortisol levels, and because the past month I'm doing quite well right now actually, but in the past months I've been really stressed, really stressed because of personal stuff, and
Yeah, me too.
I started doing.
That's why we delayed this episode, actually. I was going through personal dealing with stuff, and so it was the right timing then. We were not ready. So now we're here.
Yeah, that things happen at the exact moment when they need to happen. You cannot control that, and it is important for you that you took your time for yourself, that it's an act of true love, personal love, that the most important one, your own love. And congratulations for doing that, because people sometimes have chronopathy. We talked about chronopathy last time? No,
No, no, we
no,
didn't.
we have a lot of things. Chronopathy, it's one of the main diseases that of this time. That's the incapacity to relax. Chronos comes from time,
Yeah,
empathy for pathology, right? So it's the disease of the time. People need to do and do and do and do and do and do. They cannot relax at all. They cannot take a time for themselves and the people they love. And when they stop, they feel anxious. They feel stressed. And that happens a lot of people that I know. Most likely you do as well.
yeah,
It's incapacity for us to make a pause and remember that in our pausing moments, it's that moment that your body recovers sleeping, right?
yes,
If you don't sleep,
yes,
it will affect your whole day and activities, etc. Well, but coming back
yeah,
to what you asked, knowing that I've done mindfulness, I
yes,
absolutely love mindfulness. I do it every single day. I have an app for that, that it's a guided meditation. When I talk to my therapist about that, because she was the one to shout out to Claudia because she's an amazing therapist, uh, taught me about mindfulness. I told her, but I have done meditation with yoga. It's not the same. It is not the same. It's completely
yeah, no,
different. It's related to what you're saying. It comes. It's not the religious part of Buddhism, but it comes within that. And there's an absolutely ridiculous amount of information, clinical research about this, and the physiological and mental changes, your hormonal changes that it produces in you. It is truly amazing. If I'm asking, I'm telling the listeners and for you as well, if you haven't done that properly, mindfulness, give it a try. I will read about what you're saying because I think it's truly
mm,
interesting. I've never done that, especially even though it has respiration, because mindfulness, you need to focus on your respiration. Some people are not um, accustomed to let their even though you're trying to concentrate in your breathing, you will still think. And even though you say,
yeah,
no, I won't think, you will think and think and
yeah,
think and think. But it's bringing gently, carefully your mind back to breathing. And it helps
yeah,
a lot. And I noticed the changes. It takes time for it because it is an habit, right? Like everything, like going to the
Yes.
gym or trying to have a good diet or getting into a new job. It's completely different. And it helped a lot in that part. There are a lot of things that you can do that can help your cortisol levels. In this book, finding your vitamin person, the term vitamin person, even though it's a little bit spoiler, there's these people that when you think about them or you see them, you smile. When
Mm.
you talk to them, they calm you, they don't judge you, and you feel happy in that moment. It can be your partner or your friend, it can be your parents, or it can be your pet or memory of them for you to calm yourself. And there's this hormone that I know from her, from Marian, and I there's a hormone that is called oxytocin, and the only things that I known
Yeah.
about that is a hormone that is especially high in women because it helps during a pregnancy, especially when they're in labor for the contraction of the uterus or for the milk production when the baby is born. But recently I've learned that oxytocin, it's the neuromarker of empathy. It's the
Mm.
happiness hormone. It is the hormone that it's the counterpart of cortisol. It is the hormone that it relaxes us. It is the hormone that it helps us through challenging times. And there's a lot of activities that you can do to for you to elevate that, to increase that. The first one, that's one I love. Most people
Mm.
are not accustomed, but you cannot get accustomed, are hugs. Every time you hug someone you love, you release oxytocin. There are moments in your life that you're feeling truly sad and you hug somebody, you feel a little bit better. That's
Yeah.
because even though you're hurting or you're sad, and there's people that they're having a hard time because they're not accustomed because of their childhood to hug somebody. There's a study actually, I don't
Mm.
remember the name of the doctor, and he made a study that for your oxytocin levels to rise, you need at least 8 hugs a day. I told
Wow.
I told someone that time, and she told me like, "Are you counting them?" Because one time I saw her, and I told her that, and the next day I hugged her again because we saw her each other, and I told her one, and she started laughing because are you counting them? It was the first one was really early in the morning, and you can also elevate your reduce your cortisol levels if you exercise. Exercising it's an amazing activity, but there's a special part one. Cortisol level decreases and your serotonin, that is the happiness and it's the exciting hormone, and especially oxytocin can rise up when you do physical activity outdoors, in the
Mm-hmm.
woods, going to the mountain, or taking a walk. It's different from the space that you have right now. And you can do that. And you can, a part that is really important that I always tell people before I started doing all of this years ago is that I told them, what are the activities that you like? Maybe you like painting, maybe you like playing piano or playing guitar, or maybe you like watching a series or reading a book. That comes from the main part, knowing yourself. What do you like? What helps you in stress moments?
Yeah.
And you need to know yourself with doing that mindfulness or exercise or doing your activities and focusing on yourself, thinking your time, knowing that time that you need to stop and think and say, no, I'm not okay. I need to make a pause. Making a pause, it's not a step back because we come back to chronopathy and doing and doing and doing and doing and doing.
Yeah.
It's not about that. When will you relax? When you're 80,
Exactly.
you won't be able of doing that. And sometimes you need to take a pause, breathe, relax, and take a different perspective because it will affect everything. It will affect your sense of attention and in your capacity to make better decisions, it will affect your relationships with other people. If you're stressed, if you're not good with yourself, Denise, and that it is, even though you go or not go to therapy, because therapy is another part that we'll talk after this, is if you're not good to yourself, how will you be good with someone else?
Yeah, exactly.
It's not possible. Most, and that's the Marian's father, Enrique, is also the psychiatrist, and he says most of the crises that happen with your partners is because one of the partners is having a stressful time. So it's intoxicated with cortisol. That's the term that Marian used, cortisol intoxication. There's this part of
Okay.
your body that it's called the amygdala. It's from the limbic system. It's all about your approach to sentiment, your anger, your happiness, your sadness, etc. There's this part of your brain that is called the hippocampus. That's the part of the memory. It's
Yeah.
an action, cause an emotion. Your hippocampus will gather that information, and next time something happens like that, you will remember that, and you will get triggered. And there's this part in our brain, in our frontal lobe, that is called the prefrontal cortex. That's a part that controls your capacity, your will, your making decisions, to see in the prospect in your time, your capacity to stop. I need to do this so I can have this thing better. So you process things better. And that part in our body develops until our late 20s, starting 30s, and maybe people do not have that part developed. They just react. There's a part where we said that mecha corta, the real people that really reactful, and knowing that and understanding that with people, that the way that we see things and the way that we react, it is truly important for us to find our way to be in the best way possible. There will be moments that you will be sad. There will be moments that you will be stressed. There will be moments that you will be angry. By the way that you react to them, by knowing yourself and working on your things, will help you make better decisions, and it will help you in your personal, in your interpersonal, in your work environment, and in your life, because you need to invest in yourself for the future. What kind of life do you want to have? And for me to finish this part, there's something that I've learned recently, that it says that emotional intelligence, it's way more important than the traditional intelligence. Because you can be truly a bright person, but if you
Yeah.
do not have the capacity to interact with other people, you'll always have a barrier, and you will not be able to express yourself properly at all. Knowing that
Exactly.
and understanding that, it's for you to know how you are and working on yourself.
Yeah. And all of these, Hugo, I think it comes to that conclusion as well, that we're talking about working on that mental health that is very important. And in order to do this, work in ourselves and the mental health that we should aim to have, all of us, sometimes we need that additional help from people that have a different perspective than us, or the closest circle that we have, because sometimes we surround ourselves with people in order to kind of hear what we want to hear. And
Yeah.
because they're your friends, they will not tell you something because they don't want to hurt you. But sometimes you need to have those difficult conversations with yourself, but with a little help of somebody else guiding you how to do it in the best way possible with yourself. So here is where we fall into this part, which is discussing the stigma that exists around mental health and the use of therapy. So what is your opinion about that? Because I think mental health, like you also said before, is such an important topic now, in the present time that we live, because a lot of us are dealing with the two main things that you mentioned are the greatest diseases that we have right now in the recent generations. You talked about which was them? Well, there were two, right? One of them is
Anxiety,
anxiety.
And
and the other one.
depression. Yeah,
And although we might be very, very strong-willed persons, very difficult that if you are at that stage of depression, you can do it all by yourself to get out of there. You might need to consider some type of help. And what
absolutely.
is your opinion on that? Like,
I've always been, that's a great question, by the way, and a truly important topic. Like you said before, that there's a stigma that is in our society that even I've heard from really, really close people in my life. Because like we talked before, people do not want to for someone else to tell them, no, there's something wrong with you. You need to also for your therapist to know the way they will approach, even though it's a psychologist or a therapist, psychotherapist or a psychiatrist.
mhm,
And I've seen here in Honduras that I think that we have a very limited um, train of thought in a lot of things, that even though people do not want to talk about that, when you try to explain them the benefits, I took my time trying to explain it to you and to the audience about the emotional things for us to come here, because those are the same words that I try to explain to my patients. Because if I only tell them, yeah, I think you're stressed, I think that you're
mhm.
sad, go to a psychologist. The approach, they first of all they will not understand. Second of all, say what he's
Yeah,
talking about. Why do you send me to a psychologist? I'm fine, or I may not be fine, but my ego won't let me accept that
yeah,
I'm doing fine. My inner voice will say, don't listen to him, he's crazy. Whatever, go to somebody else.
yeah,
Like you said, because you said about people that are habilitators to for you to listen what you want to listen. Sometimes people know which people they're telling certain topics because because you know them,
yeah,
what will be their answer. And we have to have people that will tell the things in our face for our help. But for example, I always been of the thought, and this here comes with psychologists and psychotherapy and psychiatrists, that when you ask for help, you always need to ask people that know more than you in that topic. For example, I tell my patients, it's like, you can ask me medical things that are things that I know will help you. But if you ask me about civil engineering or coding or architecture, I may have an idea, but that's not my field. Everyone has their field in their life. The things that you do, Denise, even though we have formal education, and the people that have informal education, there's an ability and knowledge, information that we do not carry, that's individual for every single person, and they're experts in the things that they know. And for example, it's like you want to ask relationship advice to your best friend that her husband has cheated on her 3 times and she
yeah,
hasn't made
exactly.
anything.
Yeah,
What kind of information will you get, even though she's your best friend, right?
yeah,
What kind of information will you get on someone that person doesn't know how to handle a marriage, doesn't know how to put limits or non-negotiables or show some kind of respect? You won't get information current, even though that person knows a lot about you.
yeah,
What kind of information will you get? So you need to understand where you get that. So when a patient or someone goes, or you go to a friend and you say, yeah, I think I'm sad, I don't know what to do, I'm feeling stressed, I'm having problems with my house, or problems with my family, with my partner, or problems with my work, or what I want to do. And they say,
yeah,
and you tell them, no, but I think I want to go to therapy. And you said like, you don't need to go do that. I'm fine. And because you have doubt and because you are scared of doing something that may go to places that you may not be ready to go,
yeah,
you say, no, I will not go there. So the way that you approach that, it's the main part. Sometimes when I talk to my patients, I tell them. I am very professional, I try to be very open and seeing my patients in the eyes, even though I have to see a lot of patients in a very short time. I try to take my time with my patients, and I don't know how time works for me because I
Yeah.
finish all my patients and I tell them, we wear masks. And I wear also a mask because I need to protect myself because of diseases, right? So it's a part of
Mm.
my face is covered. And I tell them, you may see someone that is calm and is talking to you very smoothly, but you don't know what's going on in my mind, or I don't know what's going on in yours. And I know that therapy works because I go to one and it has helped me. So I share as a personal, very personal that most people will not share. I am sharing this in a podcast that every single person who wants to hear will
Yeah.
know. But I'm fine with that. I am actually truly proud of myself of going to therapy and learning all the things that I'm learning right now because I'm working on myself. And I think it's a courage act and an act of self-love. And I am proud of that part for doing that. And I try to share that part with my patients. And it has helped in the last 4 months, 100%. They go to my therapist. I don't know if she likes me or she doesn't because I send her a lot of patients, but I've seen the changes. Because I need to have current revisions with my patients for them to come back. I ask for tests or whatever, and they come back and I talk to them and I ask them, "Do you went to a psychologist?" I say, "Yes, I went." Good. And the smile. I will share a patient. I have this patient at the beginning of the part of where I was truly stressed and I started going to therapy. And she went with her mom. She was by the time 16 years, probably she's the same age. And she seemed really anxious. She was leaning forward. She was tingling with with her hand and also with the leg. She was moving the leg up and down, up and down, up and down. And when I talked to her, she didn't look me in the eyes.
Mm-hmm.
And the mother started telling me things about it, and she told me symptoms, and I was like, I think she's having somatization symptoms. I think she's really stressful. So I started talking with the minor, and I asked her, and she didn't look me in the eyes. And then the mother said, yeah, that these kids they're always rebellious.
Mm.
And the kid only looked down because she said that she was crying at school. She had a panic attack at school, a little one, but I understood it was a panic attack. That's why they called her and she went to medical consultation. And then I explained to her mother, for you to when you have a communication, there's the part when you speak of your part of the interlocutor and the receiver
Yeah.
for them to understand. You have to have both parts because you can talk and talk and talk and talk, and maybe the person that's in front of you will not understand what you're saying. So it's a bimodal, it's a two-way street
Mm-hmm.
for you to make words for them to understand in the language they will understand, and for them to take that and process that for them to make their own decisions or interpretations. So I talked to her, I asked for some tests, and I sent her to a psychologist. I explained to her the same things that I'm telling you. I saw her 2 weeks before. She had 3 sessions. It was a completely different person. She answered, I'm, I cannot control which patients I see, even though I was the first one to see them. But in this case, circumstances, life wanted me to see the changes in the patient. And I saw the mother and the patient, the children, the child, and she was different. She
Mm.
looked me in the eyes. She was smiling. She looked more comfortable, more loose. And I asked her, "Do you went to therapy?" And she told me, smiling, "Yes." How did it help? I'm fine. I'm better. And that little moment, it filled my heart
Yeah.
because because if someone else would have seen her, she would say, "No, do test or take that or whatever and leave." But I saw
Yeah.
life differently. like you say, more holistic. I take a more holistic approach in my practice. And that's what I told you, that I think my practice is doing way, way, way better. Even though there's a stigma when people when people are in the lowest. I have a really close friend, who I truly, truly love. And that person has a lot of anxiety, a lot of anxiety.
Mhm.
And she knows I love her truly. And I've helped her through the years with her problems in the best way that I can. And I told her one time, way before I started going to my sessions, that I think that she should go to someone and talk. And that person told me that, no, I think that I can do it myself. I can always do it myself. That was the ego talking, the
Mm,
pride talking, that I can
yes.
do it myself. Yeah, that's one of the inconvenience of going to therapy, for people think that I can do it. And if I ask for help, is that I am broken.
Yeah. Not
So
necessarily, no.
no, 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 because we need each other for us to help. We need, you can, if you are alone, Denise, you will go crazy. If I'm alone, I will go crazy. We need to interact with people. That's the way that we am. We need to be together. We are born, like we said the last podcast, we are born to attach. That's how we survive.
Yeah.
And recently, in the few months, she's having some troubles. And I talked to her all the things that I'm telling you, the mindfulness, that I'm going to therapy. I put myself an example, because it's not the same that I told her, you need to go, that I'm telling you.
Yeah.
I am going. I've seen the changes. And that person was willing to go. Now,
Good.
people will, yeah, I am truly happy when that person told me that. And people, when they're in the lowest, or they think that they cannot do enough, they will seek for help. Some people will be more verbal, and they will tell, yeah, I'm not doing well. It's your friend, your parents, your partner, your son, your daughter, whoever. And sometimes they will be more subtle. In depression, it's a little bit difficult. It needs to be, it's a disease like hypertension, or
Yeah.
or diabetes, and it's a disease that you need to work. Do you know, Denise, how long it takes for a person to be completely without depression, to have a major depression syndrome, major depression disease, for it to have
No.
to depression, that for depression, for there's this manual that it's called the DSM-5, that it has like for psychological and psychiatric diseases. There are like checklists for a person to make a diagnosis, right? It's a diagnosis guide for you to make,
Okay.
if a person have like a schizophrenia, or depression, or bipolar disease, or whatever. And you have criteria you need to have for you to have it or not have it, or have some of the variants. And for a person to be normal, to have the disease, I'm asking you, how long do you think it takes to people to
I don't
have
know. I'm
suicidal
not
thoughts?
sure. I don't know if there is a specific number in time.
You,
I am assuming that it might depend on the work that is done by the person. I have no
okay,
idea.
okay. For a person to develop and being normal and having the disease, it takes 6 weeks, 1.5
Wow.
months to
One
having.
and a half.
Yeah, when I learned that in pre-med, I was shocked. I thought it took more time, because people always think, oh, depression, that people might kill him, himself, or herself. Because it's not only thinking, it's not only doing, it's like thinking. You're thinking, you just want one of the criteria for depression, and it takes a little more subtlety for it to make a diagnosis. A general
Mm.
practitioner can do that, family medicine can do it, but a specialist that needs to uh, has is more subtle, is the psychiatrist. And but not most people have that. People can have moments when they're feeling sad. That's called dysthymia. That's for you to feel sad without having depression. And it is truly important for these spaces or other spaces, other podcasts or videos to have a wider approach for people to understand that it's truly important for people to talk about their mental health, because sometimes people won't ask for help because sometimes they don't know how to ask for help, or their pride or their attachment or the way they see life. But everyone has a breaking point. You know,
Mm-hmm.
and it's important to know that you don't need to go to the breaking point for ask for help. So I am telling everyone in the audience, even though it's a stress or you're having anxiety, because everyone has anxiety, or
Yeah.
you're feeling sad, or you're feeling vulnerable, you're not having a great time, a problem, it is important for you to go seek your vitamin people, the people that you truly, truly know that they care about you, the people that you know that will be there for you, the people that you know that they will get a smile on your face even though you're having a bad time, and talk. And to understand that they are architects and civil engineers and mechanics and doctors and nurses and astronauts and whatever you do in life. There are people that have studied a lot and continue to
Mm-hmm.
study a lot. They have the tools for you to try to work on your things, even though there are little T traumas, small traumas that change the way you see life, or big T traumas, or any major psychiatric disease, because there are solutions. We're in the 21st century. There are a lot of treatments that we didn't have before. Sometimes you need medication, sometimes you do not need medication, sometimes you need both. Sometimes you need to do things for yourself, like we talk about exercise, mindfulness, eating healthier, doing better habits, going outside, doing the things that you love, talking to people, being more productive, working on yourself. And sometimes you need to do that as well with talking with somebody else. Even
Yeah.
though there's a stigma, I've seen that it has changed a lot. And I think that the tendency, and I hope that the tendency goes to that. It is truly important, because if you have a problem, if you don't work on the problem, if you ignore the problem, it will not go away. You cannot ignore
No, of
things.
course. No.
No, but people think, no, I'm like that, I'm like this. People who are with me, they need to love me the way I am. Yeah, we need to understand. We need to understand that we cannot change people if they're not willing to change. Because the
Yeah.
only things that we can control are the things that we say, that we do, and the way that we react to the things that we think. Because thinking we will think. If you get mad with someone because you're driving and they take your spot and you almost had an accident or something happened, and you are tail lighting them, and even though you can have an accident, or every time someone looks mad at and bad at you, you want to push them in the face. That's a thought. You can have that thought. I want to punch that person in the face, but you don't do it because you think you control the way that your thought comes to your mind, and you have the
Yeah.
will to do that. There are people that cannot control that, and they are completely sadical or with that, or they have no control with themselves. And it's truly important for me to try to help all the people that I can't with the tools that I have, and help them understand that even though they're having a bad time in any aspect of their life, there's always a way for them to go out to be better. Even though it takes time, even though it's not an easy road, it's a road that I will repeat every single moment in my life, because the body goes, the body follows where the brain goes always.
Yeah.
The and I hope that in future podcasts for yourself, there's always a time for have a moment to talk about mental health, and
Yep.
people to educate about that, and try to understand that even though they might think it's a taboo subject, it is a truly important way for you to understand yourself and for you
Yeah.
to try to be better. and do
Exactly.
it.
In the end, it's something that you do for yourself. And it's a work that you have to understand that it takes you to admit a lot of things that you're not willing to admit. And like I said before, things that you're not willing to listen from others to tell you because you don't want nobody likes to be called out on their shit. That's the truth. We have a
Accountability.
hard time accepting criticism most of the time.
Yeah.
So, of course, if you go into therapy with the negative connotation of believing that it's somebody judging you, then you shouldn't do it because you're not ready to do it yet. That's what I think.
Absolutely.
If you're thinking that the other person is there to judge you, then you're not ready yet for therapy. And there's
Absolutely.
probably other things that you have to work with within yourself, and you might have to learn them the harsh way. Actually, when you're in that state, I think that you don't want to accept it and you're not willing to let another person help you, that is actually a professional doing it. You will probably end up learning it the hard way. And that is life is going to hit you on the face, whether it's somebody that is going to hurt your feelings in a way that it will probably make you worse because you were not willing to listen, although maybe you were receiving signs from different ways. But it will come to that moment in which until somebody really tells you something that hurts you, then you feel like, okay, why is this happening to me? But sometimes it doesn't, like you said, it doesn't need to go to that extreme for you to realize that it's okay just to have a normal conversation, to vent out. Sometimes you don't have to go to see a therapist because you're crazy. You have to go with the idea of, okay, I am not sure about what's going on, and maybe this person can give me a different perspective on what is going on,
Absolutely.
and I am willing to
Absolutely.
listen. I think that's the attitude that anyone should have when they go to therapy. I'm willing to listen. And you don't have to believe everything that the other person is telling you because you have your own opinions, of course. But it's always on you to say, this is good for me and it's going to help me. If it doesn't help you, then you discard it and you take what is good, like everything in life, I think. But I just want to mention two things regarding this about mental health and seeking therapy. And that's one thing that I took from what you shared with us right now is a lot of people don't realize, and there's somebody that said this that I've read before, we are the result of the 5 people that we surround ourselves most of the time, or we go to most of the time. And then somebody asked me, like, I don't even have 4 or 3 very, very close friends. That's fine. You don't, the phrase, you have to be open to also think outside the box a little bit with that phrase. And that's what I explained to this person. Well, maybe you just have 3 very close friends, not 5. Don't take it so literal. But who are or what are you seeking constantly? Maybe it's a public figure that you follow on social media that you're looking at most of the time. And this is like your example of something in your life. And if you're going there, that is your 4th person, maybe. And then maybe you have another one, another character that you go to and it represents something in your life and you're constantly looking at what that person is doing. It doesn't have to be like somebody that you talk to every day. That's the point of the 5 people thing. It's just things that constantly bring something to yourself and life. And with that being said, I think that is an issue that we have. And I would take it to the cultural thing again. Because in Honduras, particularly, there is these cycles that people tend to relieve and relieve and relieve inside the same circle of people that they usually move on. And like the example that you gave was exactly perfect. how do you expect that somebody that has so many issues in their life give you the best advice possible just because it's familiar to you to be around this person, because this person has been, because of life circumstances, around you for longer than a lot of other people that you just met? Doesn't mean that that person has become the expert in your life just because they went from kinder to high school, to the end of high school with you. That doesn't make them the best advisor in your life. And I think that is the misjudgment that a lot of people in our culture make. They surround themselves and they are afraid of cutting these relationships. And I have learned that. That is something that I came to terms with. I started cutting people that I thought were not doing anything for me. And not because I don't like them, not because these are bad people, but I didn't feel that they were giving me something significant. And of course, I'm going to be cordial. Of course, I'm going to be happy to see them whenever I see them again. But if they're not bringing something positive to your life, I think that's another thing that maybe I'm just going in a different direction here from, but that's part of the mental health, I think. If it's not doing something good for you, it's okay to rethink it and analyze it and decide to disconnect from that. What do you think
Absolutely.
about that?
Yeah, actually, I love that segment. Probably absolutely amazing when you do the little short ones for Reels or on Instagram.
I
Absolutely magnific what you said. Um, a lot of things. First of all, about you said about therapy. Yes, I absolutely believe 100% what you said. I want to add something. And this is true, when I searched for my therapist, it was about a week after a difficult time in my life, and I searched it on Google search.
mm,
The first one that arrived, I saw her, and like I told you, I wanted for someone that I respect, that I know that the person knows more that that I know in specific things. I'm not know it all at all, but I was trying to find someone that I can rely on what she was saying, or the person here, him or her was saying, because it was new for me. Even though I have the core belief that it's truly important, it was my first experience, and since it's a first thing, I had no experience at all, and I had backup informations, not by asking, because I saw the credentials and I saw the resume and whatever, and I said, yeah, fine school. In my case, the first therapist that I interacted with, she's amazing. I truly respect her, and she knows that because I've told her that, and she
mm,
has helped me a lot, and I'm truly thankful for her. So it's like anything in life. It's like dating, for example. You need to click with the person, especially if something that's truly personal. If that person doesn't go, but truly doesn't go, not because they tell you the truth and you don't want to hear the truth and you want to find someone that just indulge you and they tell you what you want to hear. No, that's different. That's that's
yeah,
that's a toxic behavior. That's not a productive one. But if truly it's a person that you click and you know that it's helping you, if you think otherwise, then change, find someone else. And there's
yes,
there's a video that I will share with you that is from a psychologist that I absolutely love. She's an Argentinian one. She's Marina Mamoliti, and she's a clinical psychologist. And she says she has a podcast, actually also on Spotify and YouTube as well. And she says has a video that says, how do you know that if your therapist is good for you? From a
mm-hmm.
from a therapist. And it's truly insightful because she shares the parts from someone that works in that field, that's it's truly studying that field, and she says you have to have this and this and this and this and this, and it's truly amazing to have an insightful part. How do you know the person that is helping you is right for
Yes,
you? That's what I asked
that's
for the
important.
dating for the dating example. You need to know if it clicks, if it's good for you in a truly insightful and logical part, not by your feelings, not because you're feeling hurt or you're feeling, no, by logical,
Yeah.
you're thinking, because you cannot run just by your feelings, because the world will go crazy if we only react to how we feel every time we're angry or happy or mad or whatever. No, we have to think and stop and know, is this thing good for me or is it not? Because things, they come and go. It's like the clouds in the sky. They come and
Yeah.
go.
And I think
That's what.
there's a lot of therapists that are not really qualified to do
Qualified.
therapy. So it would really
Yeah,
suck for somebody to that really needs help, you know, to bump
yeah.
into somebody that is a disaster as a therapist.
And
Unfortunately, it can happen. So it's very good that you mentioned something like this that might help to identify, you know, if it's the first time you're doing it, how to identify is if you're choosing the right person for you.
yeah, imagine you're trying to build a house and the architect that you get,
Yeah,
it's a bad one. Yeah, or a doctor or a mechanic, and you think, no, my car has a problem, and you go with a problem and you came back with three different ones because the
exactly.
mechanic did a disaster with your car. So that happens. There in life, there are good things, there are regular things, there are bad things. There's an aura of things that, and you
Yeah.
need to find the one that's really, truly with your brain good for you. And with the other things that you said, um, about the stigma that goes around with our country and about therapy, it is true. It is true that you need to surround yourself with people that are willing to help you. And that goes as well with what you said that I find truly insightful, and I've read that as well. With the people that are close to you, they will make a direct reflection in your life. And I have also done what you have done. There of cutting people that are not going with the way that I see life in the moment that I was. And I've done that recently as well. It's truly important to understand that not every person that you have a relationship is your friend. You can have a work relationship, you can have a cordial relationship, but the people that are truly close to you, you need to be, and if as you go on with your life, with you're older, you learn to understand that. Besides that, the value of friendship, of true friendship.
Yes.
And there's this phrase that also from Marian, a lot of Marian in this podcast, that she
Yeah.
says that there's a lot of concept of toxic people. And what she said, what I will say right now, is something that I felt as well, but I didn't have the words to express it properly, as she said. And she says that there are no toxic people.
Mm.
Toxic is the way that the reaction that those people cause on us. Okay.
Okay.
uh, and because there are people in your life that will rise your cortisol. There are people only, Denise, that you will think about them and you get mad, you do
Yeah,
not like
yeah.
them.
I that happens to me a lot. Like there's
Yeah,
I call it, I define it normally as I have a bad feeling about someone, but maybe there's a medical, like you're explaining right now,
yeah,
explanation to that. But for me, it's like when I really don't feel that, I really, there's nothing that you can tell me that will convince me that this person is somebody that I want to become friends with, perhaps, or be close to all the time. So that happens. Yeah, I understand what you're saying.
yeah. And you're the only people that you will think about them, you'll get mad and you will get
Mhm.
stressed and you get like,
Yeah.
up. That's a toxic reaction in yourself, because people are people and they're the way they are, but the way that they cause a reaction on you, that's completely different. And that you need to learn to, there are things that are no longer with your values in your life, and you
Move on.
either move on or you continue in that
Yeah.
environment that is causing cortisol intoxication in your life. And we've talked about what happens with you in those cases, and you need
Mm.
to choose your mental health before, always, in the first
Always,
place.
yes. And that is something that people have to understand. Your mental health and stability comes above anything else, about anyone else, or anything else. No matter,
Absolutely.
I posted this recently. I found a quote, and I posted this actually this week in my social media. You should not allow anything, whether it's a job, whether it's a partner, whether it's a friend, family member, and we're taught that we have to be there all the time, but sometimes it's not true. If they're not doing good for you in this mental space that you need to have that is should be healthy, it's okay to let go of these circumstances, people, situations, places. So no,
But sometimes letting go, it's not that easy. It
no,
takes a lot of
no,
will and a lot of
exactly.
reflection, and you need to do what's best for you, but truly best for you. Like I told you, using your brain, you can use your gut feeling, absolutely, because you use your subconscious part of your brain that is telling you something, but not of a emotional reaction because you're mad. And no, you take time, you evaluate things, and then you decide. And then you think that that situation, person, workplace, country, city, whatever, it's not working for you, and you truly
Mm,
believe that, then do the changes. Even though you might think it's scary, even though it may lead to something that it's new for you, if you think that it's the right move for you, then do it.
yes,
Because if not, if you don't take care of yourself, no one's gonna take care of yourself. That's a phrase that I always repeat. Put
yeah,
yourself in the first always. Yeah.
exactly. Well, that was nice. And just to close that, like an example, a quick example, like because it has to do a lot with you, actually. I had this friend also, and she is going through a very, very drastic physical change as well. Like she used to be a little bit overweight as well. And I am also like you. I'm not scared of sharing with people that I do and I have done therapy, because to me it's healthy actually to do it. But this person, she actually said like, no, I don't believe in those things. And I do know that there's a lot of people out there that just like her, that's the answer that you get all the time. I don't believe in those things. Like I've never believed in those things. I don't think they actually work. So I'm not sure if I want to spend my money on that, because for me it's like wasting money. And it's unfortunate because I know that this person, for instance, they're doing a lot of, they're putting the work for the physical part, you know, they're making sacrifices. They're dieting, they change all their life around because they decided to stop doing the toxic behavior that they had before with food and everything. And they probably exercise a little bit more than they had never exercised before. But I don't think that no matter what they do on the outside, and we spoke about this in the first episode, no matter what you do on the outside, if you're not doing anything with the inside, I'm sorry, sis, but you're not going to overcome all those traumas that she might be looking at herself in the mirror and she'll never be able to accept herself fully. And I know that it will take time for her to acknowledge that, but I hope she understands that sooner, because
Yeah.
that will also translate to having better relationships, finding a healthy partner in her life that I'm sure she wants. But like you said today, only when you accept everything of who you are and you love yourself and you put yourself first, and this has to do with putting this mental health first, taking care of that part, then nothing else is gonna follow after that. if you don't do it. So now, to move on quickly, because we already extended ourselves again, it's nice to speak to somebody like you, just like we spoke to Doctora Marcela Zapata as well, which was very clear that she has already found her personal legend or path, or she has just found her calling. Now, I like to ask this question because I like to see where people are in their lives with this, as I'm still looking for that. What does that mean to you right now, where you are in life right now? Have you found that calling? Do you feel like you found it, that personal legend? Any of the journey that you have gone through and challenges that you have overcome already, have they helped in some way to find that, or where are you exactly?
That's a great question. And it's a great segment in your podcast. I really like that. I think that the third podcast guest here it's Marian Rojas, because I will quote something that she says. When something resonates with me, I learn it because you need to find words sometimes from people that know things, different things, different from you, that will help you with the way that you think. And she says that your path, your passion, it's putting your heart in the thing that you do. That's a translation in Spanish. And if you truly love anything that you do in life, anything that is your work, your family, your personal relationship, your friendships, whatever, you need to put your heart in the things that you do. And for me,
Yeah.
that's the most important thing. Even though you went to college or you didn't went to college, even though you have more difficult things in your life that compared to others, you need to find a balance between the things that you do professionally and the interpersonal relationship that you have. You need to put your heart in it. It takes time because, like we talked before, there's a lot of circumstances, traumas, personal experiences, fears, unresolved issues. They can cause a conflict between the things that you do. And for myself, when I was finishing high school, I was in between going to medical school or going to architecture school, where I studied there also in university, and I had a quite a big scholarship because of my grades for me to continue architecture. And even though I love and I follow a lot of architectural things and absolutely love decoration, and I put a balance between the things that I wanted, and I chose medicine.
Okay.
And for a long time, I always try to do my best. I always try to help the people because I thought I need to find a career that I can help people because that's the things that I wanted. As I have grown older, wiser in things, I've learned that you can help people in any way that
Yeah.
you can in anything that you do because you can be a physician, a nurse, a psychologist, a psychotherapist, and you cannot help people and you just do the work that you do because it gives you money. It's a way for you to have money or status or whatever. And even though I've learned a lot after I finished my for medical school, at this moment right now, and the joy that it brings to me to help people in the best way that I can, I've learned to know, even though I was cordial and I was charismatic, or I was trying to be a nice doctor and try to help people, the way that I approach my patients now, it's completely different. Even though one of my main characteristics being an empathetic person, the way that I profess my empathy right now, it's completely different. And I came to the conclusion that truly right now, at this moment in my life, I am putting my heart in the things that I do. And that brought me joy. It takes time for a person, like I told you, Denise, even though whatever a person is going through their life and the crisis that they might have, or the doubts that they might have, because of the things that they do and the things that are important to them, and or obviously work is an important part. It's not the main part. For me, it's truly important. That's all a thought that I always had. Um, you are you. You are not what you do in your
Mm-hmm.
life. You're not a doctor. You're not a psychiatrist. You're not uh, architect, whatever. You're you as a person, because sometimes people have a hard time trying to explain when they get asked, tell me about you. No, I'm a software developer, or no, I'm a physician or whatever. That's not what I'm asking. Who are you? The
Yeah.
first step to knowing your passion, it's knowing you. Because if you do not know you, how can you know what you like? How can you know what you love? And that takes a lot of time and introspection and working on yourself. And we come back to that because that's the main thing. Knowing is elevating things. And that comes with true love, with your self-love actually. True love
Mm-hmm.
with self-love. It's like example that this Argentine psychologist that I told you, she says like true love, it's like we are in a meeting, Denise, and I introduce to you a person that looks just like you. And I told Denise, I introduce yourself. And now I tell you, okay, now that you know your name, love her. Yeah, go on, love her. But you tell me, but I don't know her. How can you know someone that you do not love? It's the same thing. If you know a stranger and tell him, love him, love her. What? No, you're crazy, dude. What are you talking about? I cannot do that. I don't know that person. Is that the same thing with you? Because we might think, oh, the person that knows me best is myself. That's not always the case.
Yeah.
That's not always the case. And so it's for me to find that purpose was to know myself. After I started, because I'm still knowing myself, it's to understand what I like. But that takes time. And even though you might start when you were a kid, or you were in high school, or you were 20, 30, 40, it doesn't matter, because your life doesn't end right now. We either worry about the past and the things that happened that are important for us to understand, or we worry about the things that will happen and we have no control. We have no control of the things that happen because they happen, or we have no control of the things that will happen because I don't even know what I will have for dinner right now. The only moment that you can control is right now. The only change that you can do is right now to have a repercussion in your future. And right now is the best moment, even though you do not know what you want, even though you do not have a clear path of what you want to do. That's a moment that will pass, and
Yeah.
your life will not end. Even though it's hard sometimes to understand that, it takes time. And there's the first step for you to understand what you want is to know and love yourself. And that's what I did. And at the moment that I am right now, at the moment that I am so close to continue with my personal journey, that I'm, like I told you, truly excited about that.
Yeah.
I came to know that even though it happens or when it happens, I will be fine. I will find my way in my life. I really hope that this happens. And closely, like I told you, we'll have this conversation in Brazil if you want. And we can go. I can go to the beach and we can have a conversation there or whatever. Um, but I think that that's the part, because sometimes people, they just say, no, I just wanted to be that because I wanted to be that, but they do not have the words to express why they want that in life. I am trying to express in words what I think with my knowledge and the things that I know I've learned, how you can learn that. The first step is to know yourself. And after know yourself and taking your time, you will find your way. Even though you might think that it's uncomfortable, even though that you might feel that it takes more time than you want, because you want, like I told you, chronopathy, you cannot stop. I need to have it right now, right now, right now. And why? Because you cannot compare yourself with no one, nor Marcela, nor myself, nor your sisters, nor your parents, nor your co-workers. You need to compare with Denise. You have a mirror on your back right now, a truly beautiful one. I really love the circular one. And the only person that you compare yourself is the person that you have in front of the mirror. That's the only person that you can compare yourself. You need to be, a person has to be proud of things that they do. Like I told you, happiness is not what, are not the things that happen to you, are the way that you interpret the things that happen.
Yeah.
And find the good things in life, little by little, working on yourself and having the patience that thing will come, because you have no control in different outcomes, but you can have a control in how you interpret things and the work that you do in yourself. So know yourself. If you know yourself, you will find your path. And that, I truly believe that.
Okay, perfect. So thank you for that. I hope that, like I told you before, I hope that everything works out from now on and in the future in the best way for you. Now, for the next segment, well, this is the more fun part of the podcast now. I usually share a meme with the guest, and then they tell me what comes up to their mind after seeing it. So I'm going to share my screen here. Can you see that? So it says,
when you're a little burnt out. Sorry, continue.
Yeah. What does the image and the message of this meme represent for you? What does it remind you of, or what is the first thing that you think about?
It's like it's like there's another meme there's this dog, a orange dog in a room that it's on fire, and there's a quote on top of the dog that says, I'm fine, I'm doing fine, whatever. And the whole place is it's completely in chaos. And that's
Yeah.
the same theme here. People, their ego or their ways or the way they see life, they have a different sometimes way for them to communicate that they are going through stuff, and they get a little burned. And when they say they think it's a little burned, they do not magnify the problems that they truly have, that may be bigger than the way that they anticipate or the way that they interpret it. So yeah, fun fact, that's Chucky, right?
Yeah.
I have a personal experience. I have a trauma with Chucky. I hate Chucky. It's a
Really?
child. Yeah, I hate Chucky.
Yeah, I didn't like it either when I was a child. Like my older brother, who is 7 years older than I am, for him he was almost a teenager. We were still very, very young. I was 7 maybe, and he was already 14. And he was always watching these because he was tough and he was watching the horror movies. But I also was terrified to see the Chucky movies. I didn't like it. Like I would have nightmares if I saw it. So
Just yeah, just a small introduction with that. I saw the movie with my grandma. I was like 5 years old, I think, or 4 years old, and it was near Christmas, and we were in
oh
Tegucigalpa. Because most of our Christmases we traveled to Tegucigalpa, and there was Christmas and the gifts, and my uncle, my mom's brother, it was the biggest one of all the gifts, and it was for my sister, and it was a rectangular one,
like the box of Chucky.
Yeah. And then the Christmas Eve, whatever, and because it's not in the States, we opened the gifts on the 24th, not in the morning on 20 or 25, on 25th. And I truly remember, I saw the movie like a week and a half before Christmas, and my sister opened the present. She was truly excited, and it was a doll. I remember brown dress, curly brown hair, and big eyes just like Chucky. And I saw that thing looking right through my soul. And since we were little, we shared the bed. So it was my sister, myself, and the freaking doll
I
in between. And sometimes I wake up in the middle of the night and the doll was turned over by my side. So I opened my eyes. I was laying on my
the
side,
doll was
and
looking at you.
yeah, it was horrifying until I have the value because I was really scared, and I get that doll and I put it in a box and I shove it in the closet, and she stayed there.
You were traumatized by Chucky. Yeah,
Yeah,
well, no, I like that meme because for me it does also represent that, like what you said, similar, yeah. The we have a hard time just admitting if we're going through something sometimes, and we say, no, we're good, we're fine. Or
yeah.
somebody asks you, how are you doing? And you're like, yeah, I'm great. Everything's
Have,
great.
I'm sorry to interrupt you. Have you seen Friends, the
Friends,
series?
yes, yeah,
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 well, there's an episode where Joey goes with Rachel, is going out, and he's with Charlie, and he was really drunk. He was having margaritas, and he burned his hands with fajitas. He was doing fajitas, and Joey asked Ross, "How are you?" "I'm fine," and he's like, he
yeah,
wasn't going like, "Yeah, I'm fine." There's a meme about that, and that's the same thing. Yeah,
yeah, it's,
your whole world is collapsing, and I'm fine.
yeah, you're fine.
That's yeah, that's truly regular, normal
Yeah.
in our culture. Yeah.
Okay. And then we also like to have the person who is invited here as a guest to share their ride or die product, which is a product that you cannot live without or that you would highly, highly recommend to the people who are listening. But you have to explain why is this product so important in your life. So can you tell us which is your ride or die product?
Since I was a little kid, I always liked technology, and I always wanted a smart thing in my hand. And now I have the the smartest thing in my hand. I have my cell phone, and my cell phone.
Okay.
I always try to have a phone that is multitasking and whatever. It might do that, or they might be as well. And I am team Samsung. I know that most people are team Apple.
Apple.
I think I like Samsung because I can do things in Android that I cannot do on Apple on iOS, and
Okay.
or my headphones. I don't use them because I brush my hair and stuff, but I love Sony,
Okay.
and I've always changed my headphones through my years. And I recently, like about a year ago, bought these headphones
Oh,
for me to
nice.
use. Yeah, and those I love music. Like I told you the last podcast, I learned myself to I taught myself to play the piano, and I always love music. I have these ones, and I have these ones, and I have these ones because I love. There's always with me. There's my keys, my phone, my wallet, and my headphones always.
Okay.
So most likely, yeah,
Cool.
yeah, that's that's me.
Great. Thank you. Thank you for sharing that. So this is the end of our episode for today. I just want to thank you again, Hugo, for being here with us, sharing all this information that you have shared and a lot of personal experiences that you have shared again with us today. Thank you for that. It has been nice to see you and talk to you again. I hope this is not the last time, of course. And I hope again, I wish you the best in everything that you have upcoming. I hope that this new year, 2024, brings a lot of good things for you. And that this journey of knowing yourself better and improving in different areas of your life continues. Thank you again for everything. And I hope I can see you again.
Thank you, and thank you for having me. I had a blast. This is my first, well, my second right now, chance to be on a podcast. I really wanted to do this. Like I told you, try to do things that are outside my comfort zone. And anytime you want to talk, I'll be here.
Okay, and just to wrap up the episode, I just want to invite everybody who is watching and listening to make sure that you subscribe to our channels. We have a YouTube channel. We're also in the mainstream audio and podcast settings. We are in Apple Podcasts, Spotify. We also have TikTok account, and we also have Facebook page, and of course for the millennials, like I usually say, Instagram, which is the social media to go to if you're a millennial right now. I think the newer generations usually use TikTok, but I still prefer Instagram. So make sure you subscribe. Thank you again, and we'll see you on the next episode.